All right, let's jump right in. We're about to explore a revolution in medicine that, well, you can literally breathe in. It's a really wild story that starts with a mystery that's almost 50 years old and ends with a technology that could totally change how millions of people manage a chronic disease.
So here it is, one of the great medical what-ifs. On July 20th, 1973, the martial arts legend Bruce Lee died. Just like that, at only 32 years old. And for decades, people have thrown around theories that maybe it was a sudden asthma attack or some crazy allergic reaction. So the question is, could something as simple as an inhaler have actually saved him? And this is where the popular theory just collides with the hard science. You know, an asthma attack? It's a dramatic idea for sure, but the autopsy? It was crystal clear. Bruce Lee died from something called cerebral edema, basically a catastrophic swelling of the brain. An asthma inhaler is designed to open up your airways, your lungs. It would have done absolutely nothing to solve the real problem.
So what did cause his brain to swell like that? Well, fast forward to 2022, and a study in the Clinical Kidney Journal came up with this really fascinating modern theory: hyponatremia. To put it simply, it's water intoxication. The idea is that Lee drank so much water that his kidneys just couldn't keep up. They couldn't flush it out fast enough, and all that excess water diluted the sodium in his blood, causing his cells, including his brain cells, to swell up with fluid.
And this wasn't just some random freak accident. The researchers pointed to what was really a perfect storm of risk factors. I mean, think about it. He was on a liquid, mostly juice-based diet. He used cannabis, which can make you incredibly thirsty. He was taking prescription drugs that can mess with your kidney function. On top of all that, he had a past kidney injury and a diet that was super low in the salts and proteins his body needed to get rid of that extra water. It was just a recipe for disaster.
Okay, so let's be clear. Bruce Lee's death was a kidney and brain problem, not a lung problem. And that brings us to a really basic question. If an inhaler was useless for him, what is their main job in medicine anyway?
Well, no surprise here, the answer is pretty much exactly what you'd expect. Almost every inhaler out there is designed to do one thing and one thing only: get medicine straight into the lungs to treat conditions that are, well, in the lungs. Stuff like asthma or COPD.
And you see this every day with common prescriptions. You know, drugs like Qvar for asthma or Spiriva for COPD, or this newer one, Brinsipri for bronchiectasis. They're all designed to work locally, right where you breathe them in. They target the lung tissue. But what if we've been thinking about this whole thing backwards?
This is where the story gets really interesting. I want you to reimagine the lungs for a second. They aren't just for breathing oxygen. With their huge surface area and web of blood vessels, they are an incredibly efficient, super fast on-ramp to your entire circulatory system. A direct delivery highway to the rest of your body.
So, what if you could hijack that on-ramp? What if you could deliver a drug systemically to your whole body, just by having someone take a deep breath? I know, it sounds like something out of a sci-fi movie, but what if you could actually inhale something like insulin?
It's not science fiction. It's real. This is Afrezza. It's a rapid-acting inhaled insulin. And get this, it was approved by the FDA way back in 2014. It's the real-world application of that whole lungs as an on-ramp idea.
So what is this stuff? Afrezza is basically a dry powder version of human insulin. People with diabetes can inhale it right at the start of a meal to get their blood sugar under control. No needles, just a single, deep breath from a tiny little device you can fit in your pocket.
The whole system is designed to be super simple. The insulin powder comes in these tiny, single-use cartridges, and they're color-coded to make it easy. Blue is for a 4-unit dose, and green is for an 8-unit dose.
A patient's dose is just figured out by converting what they would normally inject into a combination of these inhaled cartridges. So, say you needed 12 units, you just use one blue and one green cartridge. It's a really straightforward system for both patients and their doctors.
And using it is just ridiculously simple. You just pop a cartridge into the inhaler, you snap it shut, you take one deep breath when you start eating, and then you toss the used cartridge. That's it. It's super discreet and really convenient.
But the real magic here, it's the speed. Because it's using that lung on-ramp we talked about, Afrezza gets into your bloodstream unbelievably fast. We're talking peak insulin levels in just 12 to 15 minutes. That mimics the body's own natural response to a meal way more closely than any injection ever could.
Okay, so a needle-free, ultra-fast insulin, it sounds like a total game changer, right? And in a lot of ways it is. But, and believe me, this is a big but, using your lungs as a drug delivery highway doesn't come for free. There are some really serious risks and trade-offs. Now, this is absolutely crucial. This drug is not for everyone. The FDA put its most serious type of warning, a boxed warning on it, because Afrezza can cause something called acute bronchospasm, which is a sudden, dangerous tightening of your airways. That means it is a hard no for anyone with a chronic lung disease like asthma or COPD. Smokers are also out, and every single person has to get a lung function test before they can even think about starting it.
Now check this out. The most common side effect isn't low blood sugar, which is what you'd probably guess with insulin. Nope, it's a cough. A whopping 27% of people using Afrezza reported coughing, compared to just over 5% in the other groups. And for almost 3% of patients, that cough was bad enough that they had to stop using it altogether.
And this right here, this shows the biggest trade-off of all. Over a 2-year period, patients on Afrezza had a small but statistically significant drop in their lung function, what's measured as FEV1, compared to patients on other diabetes meds. And this drop happened in the first 3 months and then just kind of stuck around, making it the #1 long-term safety worry.
So when you boil it all down, it's this really fascinating balancing act, right? On one side, you've got this needle-free, super fast, incredibly convenient insulin for mealtimes. But on the other side, you've got a real risk to your lung function, that annoying cough, and the need for some really strict patient screening. It's a revolutionary tool, for sure, but only for a very specific type of patient.
Look, what Afrezza proves is that the lungs can be a real high-speed delivery route for drugs that affect the whole body. And that just blows the door open to some incredible possibilities. As we invent more advanced treatments, everything from vaccines to gene therapy, could the answer to getting them into our bodies safely and quickly be as simple as just taking a deep breath? The future of medicine might be closer and a whole lot easier to inhale than any of us think.